Hello, everyone, and welcome back to the Contractor Connect podcast, where we link vetted client projects with reputable construction contractors. Today, we have a very special guest who provides a service that every community needs, and that's dentistry. And when it comes to dentistry, all people have two fears, and that's of the drill and the bill. And Dr. Angel Garcia, my guest today, addresses both of those concerns. And Dr. Garcia, can you explain how you do those things?
Okay, my name is Angel Garcia, and I've been a dentist for about 30 years. Dentistry, it's something people feared, as Dan said, because of the discomfort involved, and as well as the bill at the end of the discomfort. We try to do things a little bit different. We have a couple of offices, one here in Palm Coast and one in Sanford, Florida. The name of our practice is Save On Dentistry. And as the name says, you can go there and at least the bill part of it won't be as painful. I don't know about the drill, but then again, the bill part will take care of it. We have a couple of small offices. The reason why they're small is very simple. Rather than having a big office with a big, we say nut where I come from, a big expense, having the small offices and then maybe expand with two other small offices makes it easier to manage, and you're able to actually save money for the clients when they come in and they need dental work. That's the reason for the size of the offices. Couple of things that we do that makes things a little bit less expensive is we do all types of dentistry in our office. We do a specialty dentistry also. We do wisdom teeth, just like an oral surgeon. We also do root canals, just like an endodontist would do. We do orthodontics. We take care of children with a periodontics dentistry, and we do general dentistry. By being able to handle the wide range of cases, we're able to save people money along the way. Every time a dentist with a good heart sends that patient to the specialist, that dentist is not making any money. Therefore, his services that he provides have to bring up the fee. At the same time, when you go to the specialist, he only specializes on that one thing that he did for you or that he will do for you. Therefore, his fees will be more expensive. But if you could put them all under one roof in one office, you're able to save the patient in both specialty work and general dentistry work, making it more accessible for people to be able to actually afford dentistry, which is a big problem that we have in nowadays. People cannot afford dentistry.
It is true.
And so
it's a very expensive service. The cost of dentistry is very high.
It's very
I have a sister who's an oral surgeon, and it breaks her heart sometimes because being able to serve her patients is very challenging because of the costs are out of control, and she can't help it. But sometimes she tries to keep her costs down, but it's very complicated because of the equipment is so expensive, the overhead, the staff, and there's just so many expenses involved. But when it comes to the problem that you're trying to solve most, what would you say that would be?
Okay, dentists, we're like architects. Look, we like to build things. Okay, we like to get a patient that maybe doesn't take good care of themselves, or maybe they don't like the way their smile is. We like to get that patient and get them to where he or she wants to be. But in today's model of practicing dentistry, that's pretty much unaffordable for a good percentage of the people. Let's say you need crowns, and let's say you want to change your smile. Well, guess what? It costs you $70,000 at least anywhere you go. Why? Because that's the market value of what it costs. When you run a practice with 10 chairs, 4 hygienists, 10 assistants, 5 front desk chasing insurance to collect your money, that is the price of the cost. This dentist is not getting that money and going and buying himself a Ferrari. No, he may not be able to pay the rent next month because he doesn't have enough patients coming in to need that type of work. In Save On Dentistry is a model that makes the difference, not the work that we do. We do crowns just like any of the other great dentists that Palm Coast has, and Palm Coast has some very good dentists. It's just our model that makes your treatment affordable.
Can you talk about some of the pricing? I mean, you talk about transparent pricing as far as crowns and...
Well, I'm going to tell you right now.
Wisdom teeth.
Our crowns go from $800 to $800. That's the price of a crown and a build-up. Everything there.
That's reasonable.
Yes, our orthodontics and aligners, Invisalign, start at $3,500. Worst case scenario, and this is a pretty tough case now, is $5,000. Now, this is a case that will probably be a surgical case at an orthodontic office, and it will probably be around $30,000 by the time they get through with it. We do it without surgery for maybe $5,000. Now, you're talking about your underbite people, your severe overbite people, your crossbite people, things like that. We rarely get any of those. What else? Wisdom teeth. Worst case scenario in our practice, fully impaction, $700, but most of the time they fall between $350 and $550 per tooth.
That sounds reasonable.
Yes. Yeah. And so the reason we can do that is because we're also doing the crown on that person and his wisdom teeth. We also might do, the orthodontics. So we're collecting from all the different services. We don't have to jack up our prices just because we do one of the services and everything else is done by, another specialist.
I understand your practice prides itself on second opinions too. You do a lot of second opinions.
Yes, we do.
Is there a lot of value in that to the patient?
Yes, it is, because people want to get treatment done, and people are willing and they're happy and they're ready to go, guns blazing out, going to the dental office. They're happy as hell. They find a very nice dentist, a guy or a girl that they like personally, nice rapport. And then when the prices come, they can't afford it. It's like when you go to the car dealership and you see that car that you want. Hey, you're not looking for a Ferrari, man. You're looking for a nice looking Toyota or a nice looking Ford. And you say, I know I could get this car. And you go there and the thing is way overpriced and you can't buy it and you go home, sad. Well, that's the fact that's happening to dentistry. Dentistry is a practice that requires years of experiences. A lot of these dentists nowadays, with the way their prices are, they don't get the full case experience the way we do because people can't afford it. So what makes you better when you're doing maybe 10 implants a month or when you're doing 1 implant a month? What do you think makes it a better solution at the end? Who do you think has a better practice? When you're doing 5 cases of wisdom teeth a month versus 1 every 3 or 4 months? When you're doing 5 root canals or 10 root canals a week versus a dentist who could only do 1 or 2 a week because of the prices. What do you think happens with a dentist that doesn't get that much
So by
practice?
doing more, you could sustain your business better.
And you could get better at it and get better results.
That's true too.
And get better results.
Yeah.
Dental schools, they're great institutions, but they're not teaching these things because they also have to sell specialty courses. So they just touch up root canals. They'll touch up wisdom teeth. But the moment you get on your own, the specialty fields, they're scaring the dentist. Oh, you shouldn't be doing that. Oh, you could never find that canal. Guess what? There are courses up there 100 times cheaper than going to a specialty school, and they'll teach you just the same way how to do those hard root canals, how to do those hard wisdom teeth, how to deal with that headache patient that you cannot have a rapport, but you need to help her because if she leaves your office or he leaves your office, no one else could help her.
That's the next thing I want to talk about. What about like emergency services when they're required? If a toothache is obviously very painful, I think it's the most painful thing a person can have.
It is the most painful thing.
It is terrible. I've had root canals before, and when it comes to an emergency, you need help right away. Are you able to accommodate your patients who need emergency care?
I'm going to tell you one thing, Dan. There is no such thing as a dental emergency.
You say there's no such thing?
There is no such thing as a dental emergency. We have dental urgency, not dental emergency. Mm-hmm. You have a heart attack, that's an emergency. You broke your arm, that's an emergency. Mm-hmm. People know that they have bad teeth and know they have a problem months, years ahead. And only when it comes knocking on their head, beating them with a baseball bat, then they want the dentist to come out of nowhere and be God. And it's not like that. But yeah, we do take care of emergencies, quote unquote, and we are very sensitive to those. But remember, there's no such thing as a dental emergency. Okay? We do have ways to work with them. We have ways to, if we cannot accommodate them, to get them out of pain. So we're not going to completely hang up the phone on them. We're going to try to get them in and as soon as we can, and we're going to try to figure out what the problem is. Sometimes the dental, there's many ways people walk into a dental office. You may walk into my dental office because you just moved from someplace else and you're looking for a good dentist and you just want to continue your cleanings and continue your maintenance.
I think maintenance is the most important thing when it
It
comes to
is.
dentistry. It's so important. Just going to the dentist regularly every 6 months or so. I think that's
It's
6 months is
super
recommended.
important. That
Yeah.
is key. People with great teeth and gums live longer. And it's a fact. There are studies that show that they live longer.
No kidding.
But not only do they live longer, they live a much better quality life.
Yeah.
Everything starts in your mouth. If you've ever taken a science course, you know that your mouth is the dirtiest part of your body. And if you don't take care of it, all that junk goes into your bloodstream, and it goes into your heart, and it goes into your liver, and it goes into every system that you have in your body. And the difference between aging quick and aging gently is the fact that you're putting junk in your body, you're not flossing, you're not brushing. Every time you floss, you bleed. That goes in there. It damages your heart a little bit in your 20s, a little bit in your 30s. By the time you're 50 or
Yeah.
60, have a ton of problems. So it is important to go to the dentist. Another important things, pregnant women and women who are lactating, their hormone mess creates more of a mess in your gums. And in the old days, back in the 20s and the 30s, women used to lose teeth after giving birth to children because,
Oh, my goodness.
they were borderline, and by the time the hormones came in and did their job, losing teeth.
I was really defiant about flossing. I was so bad about it up until maybe I was 40 years old. I realized I've had multiple root canals done because I just refused to floss. And then I finally said, I'm going to start flossing now because enough is enough. And it hasn't been as much of a problem for me now, but I've had many root canals because of not flossing, and I think it's just such an important thing. That's probably the one habit. I'll ask you, what's one habit that you would think that people should do when it comes to
To
dentistry?
maintain themselves in good shape.
Yeah.
So there are 3 reasons why you will lose your teeth, or you could lose your teeth in your lifetime. From the moment you're at, and I said in your lifetime, but let's start at 12 years old. At 12 years old, you have all your permanent teeth except your wisdom teeth. All right. So 2 reasons have to do with hygiene. Hey, you have a bad diet, you don't brush your teeth, you're gonna get cavities, right? You eat candy all day, you don't brush your teeth,
Yeah.
you get cavities. But in between the teeth are so tight that the toothbrush bristle cannot get in between the teeth. So now that's where the floss comes in. If you cannot get into that area, it's a perfect area for bacteria that don't need oxygen to live in. And this is the bacteria that causes gum disease. This is the bacteria that, what's the word that I could use here? That creates the waste product, the acidic product that actually melts your bone down. Therefore, when you go to the dentist and they're probing your teeth and they go 2, 3, 5, 7,
Yeah.
anything beyond 3, your toothbrush is not getting there.
Yeah.
So from 3 to 5, that area has never been cleaned until you get your deep cleanings done or until you get gum surgery done. Anybody with 7, 8, 9, 10 millimeter pockets, that now it gets expensive. Now you need to go to a periodontist or
I've had that done to me too. I once saw a periodontist. It was, I think they call it scaling. It was like it was like a 6-week process where it went week after week after week to have my teeth scaled, I guess they call it.
Yeah, and that's, believe it or not, to me, when I have to do scalings, that is more uncomfortable to the patient than doing the root canal. Because you have to now move everywhere, shot by shot by shot by shot by shot, to get them numb completely. That is not fun for the patient. Even though you try to do the best, you use all the tricks in the world.
I didn't enjoy that experience at all.
It is horrible. When you're doing a root canal, you just give them a couple of shots, and if it's not working, just hit the same spot over, but the spot already has anesthesia, so you could hit them as many times as you want. But gum treatment is uncomfortable for the patient, not to mention you went to a periodontist. I'm sure that hurt your pocketbook.
Yes, it was costly too, yes.
It is extremely expensive to go to a periodontist. Hey, you go to a periodontist, $7,000-8,000. It's just the basic. And it's justified. It's justified because of the work that they do. So the idea is to not get there.
Could you share a success story that captures your team's competence, like with a patient that you had?
There's 2 different types of success story. There's a success story of the patient who wasn't taking care of themselves, who was really, I wouldn't want to say ignorant, but he had no idea, or she had no idea how to take care of themselves. And then you bring them around, and they get better. And so we started with phases. The way we do treatment, when a patient comes into my practice, I look at the 3 reasons why you could lose your teeth. And I already talked about the first 2, which has to do with hygiene, gum disease, and cavities. The third reason that destroys your teeth is a bad bite. It's a bad bite for many, many reasons. You could have been a thumb sucker when you were a kid. You could have been a kid that had a large tonsils because of allergies or whatever. All these things, as you're shaping up, as you're growing, it develops, it elevates the palate. Therefore, you get narrow arches. Therefore, your teeth are not falling where they should be falling.
I have that problem myself.
Another problem that happens is that you had orthodontics and you were not follow up properly. They gave you a retainer, but you're supposed to get back and get your bite adjusted, and you never went, or the orthodontist told your dentist, and it never happened. Every orthodontic case has to be finished by a 6 months retainer vigilance with adjusting the bite. If the bite is not adjusted, old orthodontics will relapse, and that relapse happens slowly. So you get done with your child at 15 years old, and at 30, they start grinding their teeth because it takes a while to get there, or a female, because of once again, the hormone influence, at 30, they begin to have headaches. And they have a pretty miserable life. That's TMJ. That's muscle pain.
I think I have that problem myself. I have a bad habit that I can't control. I lock my jaw, and I think it causes TMJ, and
yes, it does.
I think I have a bad bite because of it.
Exactly. Yeah. So that's something that all of us, some people are immune to cavities. Some people just don't get cavities.
Yeah.
Their bacteria that causes cavity cannot live in that person's body, and they don't get it. But everybody has some sort of gum disease. So I myself brushed my teeth this morning, and I ate breakfast. So from this morning to now, I already have gingivitis. The first layer of bacteria is already on my teeth. But tonight I go home, I brush my teeth, the gingivitis is gone. See, gingivitis is reversible. Now, if your hygiene is not well, if you already have gum disease, then you have periodontitis. Periodontitis, remember what I said, beyond 3 millimeters, your brush can't get in there. So now that's not reversible. That has to be treated and get you to the gingivitis stage. Follow me? So that's where the deep cleanings come in, or the more frequent cleanings come in every 3 months rather than 6 months and things like that. And then the other thing that everybody has is not a perfect bite. It doesn't matter who you are. No one has a perfect bite. But the question is that bite causing you problems? Is that bite causing you pain? We all have TMJ. I have TMJ. You just admitted you have TMJ. We all have it. But my TMJ is not causing me any problems. It is workable. But maybe yours is. Your jaw gets locked. You have a hard time eating, at the pace that you like to. You may have headaches. You may not like the way your smile looks because of TMJ. If you have crooked teeth, you have TMJ. If you're grinding your teeth, you have TMJ. Another thing that TMJ does, over time, it damages your aesthetic. If you were to measure from the tip of your nose to the bottom of your chin, that dimension gets diminished as you grind your teeth away, your back teeth. So
that's a bad habit.
Exactly. So you end up having smaller lips as you get older. People with normal sized lips. So all these things are reversible with treatment. Our bread and butter, even though we do cavities and we do crowns, our bread and butter is TMJ treatment. So pretty much when I look at a patient, you come into my practice with an emergency, and I know you have an emergency. Okay, you should, that tooth is hurting you. I'm still going to do a complete exam. I'm going to focus when it comes time to treatment in an emergency first to get you comfortable. But I'm going to look at your gums, because it tells me how well you take care of yourself. So it tells me how successful I'm going to be with this emergency. Okay. I'm also going to look at your teeth. Is this a one-time deal? You just broke a big amalgam and now you need a root canal? Or is this a severe problem because you have a lot of large fillings, most of them are being broken apart, or you have a lot of cavities because you don't take care of yourself? So I'm going to approach that person differently than if it's just a single tooth with a crack in it. And then I'm going to look at your bite. And I'm going to say to myself, if I do a crown on this guy, is this guy going to break my crown and make me look bad? Because if he is, I'm going to tell him he's got a bite problem. And I'm going to tell him, we'll get your crown going now, because by the time you get your bite fixed, your tooth will be, more damaged, but you need to get your bite fixed so that crown that I just did will be there for the rest of your life.
Yeah.
So everything is related.
The bite has to be done. Has to be taken for first before the client.
Not first, but you got to incorporate as part of the treatment. So what we do is we break the treatment in phases to make it accessible to people, affordable to people. Because if I go to you and I say, look, you need 20 grand. By the way, 20 grand worth of work in my practice is about 100 anyplace else. Just to let you know.
Oh, good for you. That's good.
So let's say, you need, the average person in my practice needs around $7,500. That includes orthodontics, okay? And 1 or 2 crowns, wisdom teeth, the clinics. So we'll break it into phases. Hey, listen, we're going to take care of that emergency first. That's going to cost you whatever. But keep coming for your cleanings. Cleaning appointments are very important because we could see when you're breaking down. We go through emotional stages, and when we're happy, we're very good, we're very diligent with our hygiene, and then something bad happens to you or someone close to you, and you're sad now, and you're not taking care of yourself, but every 6 months you're there, and I say, hey, Dan, I think I'm going to see you every 3 months now. You're falling behind on your flossing, or you're falling behind on your brushing, or your diet went bad. And so I'm going to keep you a little closer until we go through this bad stage, and then you go back to normal, to the regular Dan that you used to be, and I'll see you every 6 months. And I always joke to people, now I forget your name, and that's good when I don't know your name, because that means you're doing good.
Right.
And the same thing, if the patient is able to afford phase 1, for example, cavities, and they're hardworking people. We have a lot of people, they don't have a lot of money, and the first year, let's do cavities. Keep coming for your clinics.
How does insurance play into all this? I know insurance is a real problem when it comes to dentistry, because sometimes they don't want to pay. And
see, I can't answer that. So I won't be able to be civil.
Yeah,
because I was
that's one of the rules.
To be civil.
Yeah. No, insurance is a big frustration with insurance.
Let's talk about insurance, dental insurance. There is no such thing as dental insurance. So somebody said to you they sold you a dental insurance plan, that doesn't exist. Insurance means they take care of you. When you go to your doctor and you break your arm, the doctor has to fix your arm. You pay your deductible, the doctor screws up fixing your arm, he has to fix it again because you paid for that and the insurance won't pay, but then they get properly compensated. When you go to the dental plan, the dental plan is kind of like the insurance companies get together and their executive says, how can we be able to sell a plan to a bunch of people that don't really care about their teeth, so make it like they can't afford it, but then because we're making it so cheap, we can't really cover these things. Because if this guy comes into our break, comes in, sends a claim for a crown and root canal, we're not making any money on that guy. So they write their plans so that they could make money, so that they're always on top. So in our practice, our prices are so low that you don't need insurance. Most of the time, what you pay as your half is what it costs to get a crown done. For example, a crown in Palm Coast costs anywhere from $1,300 to $1,500. That is the market value.
I'll be honest, I paid more than that.
Yeah, and that's not including the build-up. So you send your crown to your insurance to be paid after the crown is done, because yes, insurance company won't pay just because the doctor says I'm going to do a crown. We have to show proof with an x-ray of the tooth before the crown and after the crown, and then they'll decide if that tooth really needed a crown. So somebody that has no knowledge of dentistry decides whether your tooth needs a crown or not. Okay? And so if it costs $1,500 and your plan has $1,000, an average plan is $1,000 minus a $50 deductible, you only have $950. See, these are little tricks the insurance company play. And then they're only going to pay 50% of that crown. So you only have $950, and now you just spent $750 on a crown. Plus, you had to get an exam from the dentist. So you pretty much used all your insurance on the crown. Who's paying for the build-up? You are. You understand it? In our practice, crown and build-up is $800. You might get $400 from your insurance. We'll do the paperwork for you. We allow you to go ahead and mail it and get the claim yourself. By doing that simple thing, we're saving you more money because there's 3 extra employees that I don't need to have in my practice. That's half of my payroll right there. Getting rid of half of my payroll, therefore I could give you the same quality work for half the price. And that is the model Save On Dentistry. You have insurance, I am glad you do. It's going to help you. We're going to do the paperwork for you and give you the proof. You put the envelope in the mail.
One thing I find fascinating about dentistry is the equipment that you guys use. Some of the high-tech equipment is really incredible from what it used to be, where they do, I guess they do CAT scans, and I don't know, do you have like any high-tech equipment in your office?
We have partners that come to us if we ever need any of that. There are companies who do scans, and there are companies who do different things if we need them. They're only needed for special situations, like sometimes root canals, implants, and things like that. But we don't need it if we're doing crown, or we don't need it if we're doing fillings or cleanings. So out of 100 patients I see this month, maybe one, maybe none will need that type of service. So having that in the office is just going to increase my fees.
I see.
A scan machine costs anywhere from $500,000 to $250,000 to if you really get fancy $1 million. They even have machines that will put the implant for you. Yeah. Hey, if I could charge you $5,000 for an implant, I'll buy one of those machines right now. I have the guy's business card. Okay, yeah. But you know what? The average person can't afford it. Hey, if you have a practice in Coral Gables, or if you have a practice in Hollywood, California, not Florida, maybe they have the type of Manhattan, maybe they have those type of patients. Palm Coast may have a few of those patients, and hallelujah, but the average person in Palm Coast is not that type of patient.
Okay, Dr. Garcia, it was really a pleasure talking with you today, and I hope you enjoyed being here. And I think our time is running out, so we got to wrap things up. But it was really interesting hearing about your practice and how you help your patients, and I hope you'll be successful in your business.
May I say one last thing? Our model, I think, is going to be one way that's going to help people afford dentistry. We are seeking investors who may be interested in investing in dentistry, investors who are interested in helping people and making some money in the process. Our model does work. My offices are doing pretty good in what I would call probably 50% of what we are capable of doing. It's a marketing game out there. And the one with the most money is the one that gets the most patients in. And basically, we find it very inexpensive to set up an office. And most of our investors will be investing in the marketing plan of it. And the marketing itself would roll over until the offices are able to just be on their own with limited marketing. So I'm just giving the word out. If anybody's interested in investing, please call our office or go into our website, saveondentistry.dentist. That's saveondentistry.dentist.
Awesome. Sounds fantastic. Best of luck to you, Dr. Garcia.